All right, this is Dr. Ron here. I'm sitting here with Dr. Ankur Mehta at the TX Spine and Joint, where just behind us, he does a lot of cool procedures to help people with spine injuries, and that's what we're going to talk about today. So you told me something the other day that bugged me a little bit, and is that when people get spine injury is not like broken arm or leg or something, because you can't rest it.
That's right.
And you can't rest it because even when you're laying down, you're still using your spine as a support structure. When you're standing up, you are. So how do we deal with spine injuries?
So yeah, I mean, Dr. Ron, that's a precise point. So essentially, let's say you break your arm, you put it in a cast. 6 weeks later, no biggie, you're going back to the golf course. Spine, I mean, you're sitting, standing, laying down. The spine is always having the effect of gravity on it, no matter which position you're in. Now, granted, laying supine with your knees and hips at a 90-degree angle is probably the lowest pressure you can put through your spine. But that's one of the reasons that it makes it such a challenge to deal with people that have degenerative back or disc herniations or back arthritis or even just simple old back pain.
So doesn't seem very fair. Because I think when we think of the spine, medically, it's a structure that holds us up. It holds the spinal cord in it, and then you have nerves that come out, and you have spinal compression on different sides. But what's even more interesting is that the spine is held taut by structures that are around it.
That's right.
Right? There's ligaments, there's paraspinal muscles, there's your core muscles, even your abdominal muscles actually help your lumbar spine.
Correct.
So when people have spine injuries, they have weakness of those associated muscles and structures, right?
Correct. So let's take a step back to like basic medical school anatomy. So the spine, it has so many different functions. Okay, from a carpenter perspective, it's the structure. Mm-hmm. It's a structure of the torso. It holds you up straight. From an electrical perspective, it houses the most sensitive nervous tissue in the entire body, your spinal cord. It is the pipeline and the gateway for your brain to communicate with your fingers and your feet. And not only that, one of the things that we learn in osteopathic medicine and acupuncture is about parasympathetic and sympathetics. So when you have spinal pain, it affects the sympathetic outflow and the parasympathetic outflow. And so essentially it regulates your blood pressure, it regulates your mood, it regulates your bowels and your bladder and your nerves, your motor. So it has so many different functions. Now, let's take a step back. Let's say you herniate a disc or you have degenerative arthritis. What happens when you have inflammation?
You hurt?
You hurt and you have swelling.
Yeah.
Right? So can you imagine having swelling next to the most important neurological pathway of your entire body? Can you imagine the havoc it wreaks on your blood pressure, on your mood even, on the way that you walk? Some people get a foot drop, some people get numbness or shooting pain down the legs, some people have tingling in their fingers. So these sort of things are incredibly sensitive to even a small defect in the spine. And that's one of the reasons I tell patients whenever they have back pain, don't ignore it. Get it treated, find the root cause. Don't just take a muscle relaxer or ibuprofen and a Tylenol and keep going on life, because it could be something serious.
Yeah, that's exactly what we find too. So a lot of people have these chronic pains, but not only that, some people have no pain, but they actually have some digestive issues.
That's right.
And when we refer them to see you or another practitioner to look at the actual spine, when there's better spinal misalignment, their digestive issues starts to improve, right? And honestly, that's not something I learned in medical school. Just from people, getting treatments for their spine. And the other thing is that the spine is so linked to everything in your body, right? So as humans, we need symmetry. We need symmetry to function, And your spinal alignment dictates your symmetry. And a lot of times when people come into my office and they're saying that, I got chest pain going on, I've been short of breath, I went to my cardiologist, I had a cardiac cath, nothing came out of it. They say just take these medicines, you'll be okay, and then it gets worse. And then when we do a physical assessment, we're like, wow, you have some, when I look, their right shoulder is 2 inches higher than left shoulder,
right.
Major spinal misalignment, and when we treat that, all of a sudden things got better. And this actually happened with a patient of mine where she went through stress tests and cardiac cath and was put on 5 medicines that she really didn't need, honestly.
Right.
And she still had the dang pain after about 6 months of medical therapy.
These are invasive procedures.
Yeah, they are invasive procedures. And then I examined her and I was like, well, this is a really tender area in your right paraspinal area. Let's get someone else to take a look at it. And then boom, problem solved within a week.
Yeah.
Right? And so, having said all that, let's talk about regenerative medicine in the spine. Now, how do you regenerate some of this stuff?
Sure. So there's a couple, there's two pots of spinal injury, right? There's a one guy who, got thrown off the bull at the rodeo, or got in a car accident, and there's a traumatic hit to the spine and the discs herniate, and there could be a fracture. And then there's the other bag, which is the people that have just lived a life, and gravity has taken its toll on the facet joints and the discs and the bone tissue of the spine. So we'll talk about that group. Okay. Essentially, this group of patients will benefit from regenerative medicine to heal the degenerative changes of gravity and of aging. And it's kind of like putting a new layer of, like a new cushion on the facet joint, so that there's not as much grinding when they move their neck. There's a lot of people say there's popping in my neck.
Yeah.
Well, we can inject PRP, or we can inject bone marrow stem cells into the facet joints to actually regenerate the cartilage and to help strengthen the ligaments. Earlier you said something really interesting, and I wanted to talk on that. Is that the spine is kind of wrapped up. If you imagine this is how I describe degenerative spine, and it's kind of going off on a tangent, so forgive me, but it's a very important concept I want people to understand. Imagine you have 10 pieces of celery, okay? You take those pieces of celery and you take a saran wrap, and it's fresh celery, just cut it, and you saran wrap it really, really tight. And now there's 10 pieces of celery, it's really tough and strong, right? And then you just leave it on your kitchen counter for about a week and a half, and then by the time you come back, everything's dehydrated and it's kind of limp. And then try bending it around. It's squishy, and the saran wrap is no longer providing that taut structure of stability. And that's what leads to spinal instability, and that's why fusions became so popular in the 1980s. And they went out of vogue now because people are finding out that, just throwing screws and plates on the celery is not going to fix it. You need to actually strengthen the muscles around. You need to make that saran wrap tighter. And so that's the concept of degenerative spine. When your discs get dehydrated, when your bones start collapsing, when you start getting arthritis, that's the concept I want you to really go back to kind of understand what's happening in the spine. So in order to treat that, we can do a bone marrow concentrate into the discs. We can do bone marrow concentrate into the bone. We can do bone marrow concentrate or PRP into the discs. And also, there are some researchers right now working on injecting platelet-poor plasma, which is basically they take your blood out, they get rid of all the red cells, throw them out. Get rid of all the white cells, throw them out. And now they just have this little mix of plasma, and they inject that around the nerve. And they're finding that just that plasma with this concentration of growth factors can actually help with nerve regeneration.
Wow, that's amazing. So, what about the actual vertebra itself? How can we make the old lettuce look like the new lettuce again, or can we? Is that possible?
So there's a couple studies going on right now, and I'm actually working with a professor out of France, Dr. Philippe Hernigot. I had the honor of doing some cases with him recently, and what we're doing is we're taking the bone marrow and injecting it into the bone. So basically taking bone marrow to one part of the body, concentrate it, which the FDA is okay with, was because minimally manipulated, just centrifuging it, concentrating, and then taking that and putting it into the defective bone. And they're finding out that it's actually helping to heal the bone tissue itself. And there's a whole nother series we can do on what's called vertebralgia. It's a new concept where people are like, oh, your disc hurts, your nerve hurts, oh, you have back arthritis. Well, guess what? Now there's a whole new concept called vertebral body pain, where they're saying that the bone of the spine can actually be the pain generator itself.
Wow. Okay.
So
So we have some ways of dealing with it.
Oh yeah, we do have some exciting concepts, and always to go back to the initial concept that you need to have a healthy, happy organism, and then we optimize it. So we optimize the organism, then we put the bone marrow in there, we put the PRP in there, and it's kind of like a 1-2 punch. In my practice, it's been very, very effective having that team approach.
Okay. And does this also work for compression fractures, where you just the spine compress on itself, or is it something different?
So it just depends. There are many different types of compression fractures, and some people would believe that it does. There's certain compression fractures that are acute, where they're 40 or 50% height loss, where at that point traditional options with putting a balloon in, filling it up with cement would be the way to go. But mild fractures, I would imagine that this would help. Absolutely.
Okay. And so, there's people living with low back pain forever. They ignore it, right?
Absolutely.
And I think the lesson here is get it treated earlier with better results versus later with much worse results, right?
Exactly.
And so, what about those people who have had long-standing pain, but they failed a lot of conventional therapies? And then, we have patients that have a lot of previous spinal fusion surgeries, right? They have a lot of hardware in the spine, and they're still hurting like the dickens. And they don't want to see another doctor because they got a million procedures already done.
Right.
What can we do about those patients?
So, there's a couple different concepts out there right now. One of them is, okay, well, where's the pain coming from? And that's what I do in my practice. That's my number one focus, is to identify the exact etiology of your pain. Is it a loose screw? Is it just that your paraspinal muscles have turned into like a marbled steak instead of being a nice fillet? That's one of the things that I always look at the MRI images with my patients.
So you can see it on the MRI.
Oh yeah.
Okay.
Where's the pain coming from? Is it weak muscles? Is it the screws loose? Is it a bad ligament? Is it a disc? Is it the bone fracture?
Okay.
And then once we find that concept, we move forward. Now, traditional healthcare treatment options would include spinal cord stimulator. We can put a wire in. It's a solid state system, no moving parts, and it attaches to a battery. We turn the battery on, it sends an impulse to the spinal cord at around the T7 to T10 in that region, and we map it out while the patient's on the table, and then we can apply a millivolt current, a milliamp current to the spinal cord, and it essentially blocks your body's ability to send pain to the brain. So maybe everything's normal. There's no fracture, there's no problems, they're doing therapy, they've tried everything, it's just that the nerve was nicked, or there's scar tissue forming on the nerve. And then in that case, these treatments work very well.
Okay, wonderful. Well, that's it for the spine. I hope you guys enjoy this. If you have any questions, feel free to comment below on it, and we'll come out with a whole lot more videos, right?
Absolutely.
Thank you very much.